Welcome to the Global Procurement Training Program. This video discusses the revised WHO Non Communicable Disease Kit 2021, also called NCD Kit. At the end of this video, you will know how to ensure that the target population is reached and that the needs are covered in order to save lives. Place accurate orders which truly reflect the needs. Handle the NCD kit when it reaches your warehouse. The NCD kit was designed to facilitate the provision of priority non-communicable diseases health services. It is intended for outpatient care in primary healthcare settings. Each kit is assembled to care for NCDs among a population of 10,000 people for a period of 3 months. The NCD kit provides essential medicines and medical devices for the management of hypertension, diabetes, chronic respiratory diseases, as well as mental health and neurological conditions. Now let's learn about the NCD kit content and the changes compared to the last version of 2016. Changes were made to the modularity and medicines in the kit to better respond to countries' needs. This means that the NCD kit is now divided into 6 modules. It is very important to remember that the modules can be ordered separately and in different quantities. This way, countries can request the specific modules and quantities they need. Their order must be based on both their epidemiological profile and workforce capacity. Module 1 contains essential medicines to treat hypertension, type 2 diabetes, and chronic respiratory diseases, including, for example, statins, ACE inhibitors, oral hypoglycemic agents, and asthma medication. What is new in Module 1? Gliclazide, fixed-dose combination enalapril plus, hydrochlorothiazide, children formulation beclomethasone inhaler. It is essential to ensure that general practitioners and nurses are familiar with the kit content. The Module 2 is completely new. It is designed to give comprehensive support to health facilities caring for mental health and neurological conditions. It contains medicines such as amitriptyline, fluoxetine, risperidone, but also carbamazepine and valproic acid. This module does not contain controlled medicines. However, it must be handled by a trained physician. Now, let us focus on Module 3, which contains human insulins. Note that the quantities of human insulins were increased to better satisfy the country's needs. Remember, this module requires cold chain management, so watch our cold chain video. Module 4 contains renewables such as urinary test strips, cotton wool, examination latex gloves, adhesive tape, and alcohol pads. Because it contains renewables, this module can be reordered separately whenever necessary. The 5th module holds medical equipment. It contains devices such as a peak flow meter, body tape measure, monofilament devices for diabetic foot screening, as well as inhalers chamber. Equipment can be reused. Therefore, this module should only be ordered as initial donation. There is no need to reorder it. In this new version of the NCD kit, a glucometer with strips and lancet pens are available in a specific module, Module 6, so that they can be reordered separately whenever necessary. Let us now discuss the reception of the kits and go through the points that require particular attention. The different kits and modules can be easily recognized thanks to the labels on the top right corner of each box. All the WHO kits have color-coded labels. The NCD has a yellow label which displays the kit name, the module name, the WHO code, and the number of boxes per module. The label also indicates the expiration date of the first item to expire in the module. Remember that Box 1 always contains the short shelf life item or items. On this example, the label shows that the box is part of the mental health module. It tells us that the mental health module is composed of 3 boxes, and that specific box is the box number 1. Finally, Module 3 is a cold chain module that must be handled and stored with particular care. So, when the module is received, the data logger must be carefully checked and any anomaly must be immediately reported to the pharmacist. Please watch our cold chain video. Now that we have presented the details of the NCD kit, let us recap. The NCD Kit 2021 is designed to provide NCD medication, supply, and equipment for an outreach population of 10,000 persons over a period of 3 months. It provides continuity of care for non-communicable diseases in primary healthcare settings. NCD Kit is composed of 6 modules, 3 containing medicines, 3 containing supply and equipment. The 2 medicines and mental health modules must be handled by trained health professional. Module 3 requires cold chain. Transport and storage must be carefully anticipated and managed. NCD Kit finally contains 3 supply and equipment modules, 1 with renewables that can be reordered when needed, 1 with equipment, and finally, the new glucometer module for diabetic patients. More information about the kit use, content, and forecasting can be found on the detailed information note and dedicated website. Thank you for watching this video. See you soon.